Okay, good evening, everyone, and thank you for joining us on another webinar organized by Torat HaRefuah, which is going to its first anniversary yet. I would like to thank Rabbi Dr Ray Sultan, who's joined us for this special event. Rabbi Dr Ray Sultan is a practicing adult general urologist at Mount Sinai in New York. He received semicha from Yeshiva University, and he received his medical degree from NYU, and he is currently practicing predominantly in adult urology, and is also very busy Mohel, and has written many articles and is actively involved in medical halacha. Very, very proud that he's agreed to give us time with us, and I will hand over to you. If you have any questions that you'd like to ask, please put it into the chat, and we'll be able to put those forward to Rabbi Sultan at the end. Thank you very much. Over to you.
All right. Thank you, everybody, for joining. I'm not as adept at Zoom presentations. Feel free to unmute yourselves and ask questions. Feel free to ask questions in the box. I will try to get to them. Introduction. What are my qualifications? What gives me the right to speak about Brit Milah? If you go on YU Torah, you could find hundreds, thousands of articles on the Hilchot of Milah. But I think today I'm going to bring a unique perspective. I gave a smaller form of this a few weeks ago, and it was very well received. As somebody who obtained smicha from Yeshiva University, as someone who does adult urology but trained in pediatric urology, I always felt comfortable with Brit Milah. I would always get asked to do Brit Milah, almost too many. Many people would start saying to me, we want a doctor to be doing the Milah. A funny story is a few months ago, I did a Milah in shul, and it was so quick. It was about 8 minutes door to door from the time the baby went in to out. And the Rabbi Emeritus came over to me afterwards, and he looked at me funny, and he said, where did you get your smicha? Where did you get your right to do Brit Milah? And I looked funny, and I said, well, my father did it. He's a general surgeon, and his father-in-law is a urologist who taught him. And I thought that was a Masorah, but immediately after Shabbat, I went over to my father and I asked him, I said, where do we get a Masorah to do this? Do I have heter to do Milah? And he said, yes. One time in the community I live in, West Hempstead, Rabbi Kelmer Zatzal supervised me and said, you're good to go. But it is a question of who has a right to do Milah. Is it somebody who just knows the anatomy, a urologist? Is it a rabbi who does smicha? Or is there a formal training? And it's hard to find that answer. It's pretty clear that there is a requirement for a formal training and supervision. What I'd like to do today is jump into two topics that I could speak on: anesthesia and using gloves. And then I'm going to branch out and speak more about observations, clamps, other things, techniques, things that I see as a urologist that might be at a high level. Dr. Kahan asked me to speak on this topic, but speak at a high level. So I'd like to give insights that you don't hear every day. My first topic is about anesthesia. The question is, why aren't we doing more anesthesia for a bris? I remember a few years ago, a doctor friend asked me if I would perform Milah, but I would specifically only if I would do anesthesia for the baby. And I looked into it, and I looked at the dosage of and a ring block and a cord block and what would be involved. But first I had to look at the halacha. Let me go through the halacha. It's fascinating. When you ask the question in halacha whether or not baby anesthesia should be provided during a, if you're talking of one of three people, are you talking about a baby, the standard bris milah, 8 days? Are you talking about an older person, someone who didn't have, and now at an older age decides that they're ready, or for whatever reason is now getting milah? Could they have anesthesia? The third person is a convert. I had the privilege with Rabbi Aaron Glad in my hospital of doing a milah a year or two ago for a, so that's not in the art scroll, a bracha that you can only find in the Shulchan Aruch. And it was a beautiful process. And we gave general anesthesia, but I came to learn that that's a controversial question, but again, Jew versus a convert, because a convert has their own question of, are they yet Jewish? Are they mechuyev in mitzvot and mitzvot tzricho kavana and questions like that? And it becomes a whole Torah of, is the Milah before a bris just a matir, or is it a mitzvah in of itself? So the first question that we ask about anesthesia, Rav Avad Yosef in a beautiful tshuva, Yabi Omer 522, he asks, don't mitzvot tzrichot kavana, essentially. So his main topic is, he's addressing specifically an older Jew, someone who's Jewish, who didn't have anesthesia when they were younger, and it would be too painful. Sorry, didn't have a milah when they were younger, and is now ready to have a milah. Can they do a milah with anesthesia, is the question. And so he brings up a very fascinating paradigm about giving so his first question is, assumption is that you mitzvot tzricho kavana. And so the obvious question is, if somebody's asleep, can they have kavana while they're sleeping? And so Rav Vadia brings up the concept of shlichut, of right before he goes to sleep, he's obviously appointing the same way that we have a father appoint the mohel to be a shliach. We can't the man who's having a milah have, before he goes under anesthesia, appoint shlichut. And the question is that, does that work if they're sleeping or under anesthesia? So he brings a model where it's fascinating, but in Gittin, let's say a couple's having a divorce, and they're on such animosity that they don't want to even speak to each other. So they appoint let's say the husband appoints an agent, says, I can't even present it myself, but you present it for me, the get. And it happens to be that it's far away, and the person is sleeping at the time that it's given over. Is that still a valid get? And the answer is yes. He also brings up the question, what if somebody's drunk? So it's not only that it's worse than sleeping, because it might take some time. And he brings up this concept of mechusar ma'aseh, meaning if somebody's so close to just be awake and alert, then they could act as a shliach. But maybe if it's it requires a ma'aseh to wake them up, and then it becomes a whole question. I spoke to my anesthesiologist friends. Some anesthesia, we'll get to that question. Some anesthesia requires a reversal agent, and some of it will just wash out of the system on their own. So it relates to Rav Avadia's question. It also relates to the question of a Torah, of whether or not the milah itself is a ma'aseh or a totza'ah, meaning, is it important to do the milah, or is it important just to have the result of the milah? And that goes to a fundamental machloket between the Rambam and the Ravid, where the Rambam says that if somebody, it's such an important mitzvah to have milah. We know the famous story that David HaMelech looked down, or Shlomo HaMelech looked down and saw that he was always had even when he was naked in the bathhouse, he always had a mitzvah with his Brit Milah, and so. But the concept is that mitzvah a constant mitzvah, or is it a one-time mitzvah? And the Rambam writes that if somebody passes away without doing that mitzvah, at that point he's chayav karet. And the Ravid says no, he's chayav karet every single day. And it goes to a Torah of, is it a mitzvah to be mal, or is it a mitzvah to do the milah? That's a beautiful tshuva by Rav Avad Yosef. I'll get to the essentially what Rav Yosef says is that when you put it all together, you can apply shlichut, you can have anesthesia, you can be asleep for the moment. The mitzvah is to have to be mal, and therefore Rav Avadia is supportive of anesthesia, both for adult and for children, both general and local. Another big argument that's brought up, the most common argument that's brought up, very, very practical statements by Rabbi Arik and Imre Yosher, is it was available for ages and wasn't used. It's a fascinating question. If you learn Bava Kama, part of Bava Kama is when somebody injures somebody else, they have to give reparations. They have to restore them. The 5 common reparations, I'm going to mess them up, but Sar, Boshet, Ripoich, Nezek, and Sar is one of them. What does it mean that if I injure somebody, I have to pay them back Sar? So the Gemara says, you calculate is the difference. How much would somebody pay to have their hand chopped off with anesthesia versus without anesthesia? Meaning there was anesthesia for centuries. I don't know if we still have Rabbi Reichman here, and I know he's busy, but the history behind anesthesia, I'm sure, is available for ages. And so the question would be, why haven't we used it before? And the implication would be that maybe it's not necessary for Milah. There's even another argument that's brought out, which is more challenging, which is it a Milah? Is it a positive to have pain during the Milah? There's a Kabbalistic source that says that at the moment of the Milah, the gates of Shemayim, or the baby's cries, go straight up to heaven, and you see many people at a bris Milah traditionally praying at that moment. The concept being that it's an 8 ratzon and 8 rachamim. Rav Avram in the Nishmat Avram, he writes up very nicely that he never really found the source. He humbly does not know Kabbalistic sources as well. So he writes that he asked Rabbi Yaakov Hillel, an expert in Kabbalistic sources, to look into this topic. And what he says, Rabbi Hillel said, find such a source for such a minhag, that there is that the baby should be crying out in pain. And even more so, he says that there are many sources in Kabbalah for the concept of childbirth atoning for the sin of Chava, and there's nobody, including myself, that would tell my wife that she can't have anesthesia during pregnancy. There's another source that says that Avram Himol Timo, that Avram asked for a double reward, that he wanted the pain during the Milah, that it would give him more reward. The counter argument to that, though, is Kol HaKavod to Avram. We're not all of us are at the level of Avram Avinu. And then the last argument that you hear over and over and over again is nothing new. There's a really important, what you're going to keep hearing in any in any shiur about Milah and novel devices, is why are we changing it? Is it appropriate to change what we've done for years for tradition? Practically speaking, what can we do? What should we do for anesthesia? And then I'll get to Lamaisa, the Psak Halacha. Practically, the blood supply for the Milah is a double blood supply. If some of us remember from medical school, there's both a deep blood supply and a superficial blood supply.
Do you mind if I just listen?
Please. Oh, someone's listening? So if there is a question, you're welcome to ask. Practically speaking, there's a double blood supply. So to provide a local block, I just did one last week, you need a healthy amount of anesthesia and you need a compliant patient. So to do it on a baby is really challenging. To do a dorsal block as well as a ring block, you're having to stick the baby about 5 times. The dorsal block is 1 block, and then the ring block is usually about 4 different punctures. And with the moving baby, it's a real challenge. And even more so, that there's lidocaine has toxicity. So yourself how much you should be giving. And when I asked anesthesiologist, the one time I tried to give anesthesia, how much I should be giving, he said maybe 1.2 ml. When you're talking about 1.2 ml, it's not, you don't have a lot of anesthesia to spare. So it's very challenging to supply a local block for a child. That being said, for an adult, you can give a healthy block. For an adult, if you give enough anesthesia, lidocaine, you could adequately, in my humble opinion, give appropriate anesthesia. Mentally, most patients want to be asleep for it, but in theory, especially some poskim say for a conversion, if the person is supposed to be awake, it is possible to anesthetize. There's a lot written about 20 years ago about sucrose. I think practically we all do use sucrose. In the hospitals, they use sucrose. There are papers that say that it works. That's a question. And then the real one that I think we should be asking ourselves as a community is EMLA, is the topical lidocaine. Now, the problem is EMLA topical doesn't absorb as well. The keratinized skin, it takes at least a half hour to kick in. I tried it myself one time. I didn't feel much of a difference. I put it on my finger. But there is lidocaine cream. The argument against it that most molim say, and I respect, is it's too slippery. It's oil-based for it to get under the keratinized skin, and you can't risk having any slipping. The precision of the Milah cut is within millimeters, and it's not acceptable to risk a slip. And the other thing is the time. Just practically speaking, you have to peel back the foreskin first, then apply it, then apply it even above the foreskin, and then wait a half hour. There's a lot of swelling that happens. A lot of molim we do nowadays. Milah and priya vadachat we'll talk about. And to do that, you have to peel back the foreskin back even beforehand. One of the big problems with doing the probing beforehand is that the swelling sets in. Swelling could set in. You could do it 5 minutes later, but a half hour later, it could really change the milah. So practically speaking, EMLA has a problem. On the other hand, it's probably the best idea if we are going to want to push for that as a community. Lamaisa, the Piskei Halacha that I saw, the Tzitz Eliezer, I read that he prohibits general and allows local under pressing circumstances, trying not to change tradition. Rav Shlomo Zalman Auerbach, I read from Rav Avram, maybe even it be an obligation. Rav Moshe Feinstein, I read, says that he doesn't allow it if there's a danger, but he writes about the importance of Sarah Dianuka. And Rav Avad Yosef allows both general and local. The next topic I'm going to jump over to is gloves. Especially with COVID nowadays, maybe even masks. I don't know if you've seen it, but in America in the past 20 years, more and more molim are using gloves. I don't know if it's just for the parents or if it really makes a big difference. We know, same as the hospitals, as a surgeon, 50 years ago, they weren't using gloves. Urologists, of course, use gloves, but we don't always do sterile technique. We don't always scrub beforehand in America. I don't know why urologists get away with that as a semi-sterile environment. But the standard of care in the operating room is to use a glove. And the question is that something that should be brought to the milah? Is that not necessary? Is it a perversion of the milah process? Or is it a good idea? Does it add safety? Probably most of the people on the Zoom respect infectious disease principles, and it makes a lot of sense to use gloves, even sterile gloves. So the question in halacha comes down to two potential obstacles. Number one is bizui mitzvah, and number two is practically if prevents priya. So question number one, is there a bizui mitzvah? So there's a fascinating Gemara that says in Gemara Psachim that there was a cry out from the Azara, the courtyard in the Beit HaMikdash 4 times. And one of those times was because of Yisachar Ish Kfar Barkai. He was a Kohen Gadol that honored himself and disrespected the Kadshim because he used to wear gloves while performing the service to Beit HaMikdash. The story even gets more twisted. It's a Agadata. It says that he was called to Rome because he was an expert. And in Rome, they asked him which is better meat, venison or regular meat. And he dismissively waved his finger like it was an obvious question. And the king said off with his hand. And then he bribed the executioner to use the other hand because he was a righty, not a lefty. And the king said off with both of your hands. So the moral of the story is that using gloves, if somebody uses gloves during the avodah in the Beit HaMikdash, bad things can come of it. So the question is using gloves during a milah the same concept of bizui mitzvah? The Gemara has halacha has other examples. When a man performs kedushin and he puts puts a ring on her finger, can the woman wear a glove? The halacha says no. If you're holding wine for kiddush, you're not supposed to wear a glove. If a sofer is writing a sefer Torah and adding the ketarim, they're not supposed to wear gloves. And if a shliach tzibur is carrying sefer Torah, they're not supposed to wear gloves. That's a question because during COVID, my shul under healthy psak, we were using gloves for sefer Torah. And you know, it's going to come out as I bring out this topic. There's an easy teretz to that. The best Shaila B'tshuva you could find on this topic is a correspondence between Rav Moshe Feinstein and Rabbi Cheskel Grubner, a shochet in Detroit, Michigan, in America, and they talk about whether or not a shochet can use a glove when they're feeling. Is it a bizui? Do you need the tactile feedback? And what it comes out, there's a paradigm in Gemara, in the Gemara Sukkah, where Rav actually says, you wear gloves when you're holding a etrog? And the answer is yes. And it comes out that the chiluk, the difference is, are you wearing gloves for your own for your own istiness, for your own protection, or are you wearing it for the beautification of a mitzvah? Meaning, if you went to an auction and you saw them holding a beautiful diamond jewel, you wouldn't be surprised for them to not want to scratch up the jewel with gloves. And so the same with an etrog. And then the question becomes like the Kohen Gadol and that Agadata, was he wearing the gloves to protect his own squeamishness from the blood, or was he doing it to beautify the mitzvah? And that's what the Piskei Halacha seem to come out, that if you're wearing gloves to beautify the mitzvah or to enhance the mitzvah, kol hakavod, but if you're wearing gloves because you're showing that you're not embracing the mitzvah, then there's a hesitation in Halacha. The second, and I'll get to Psak in a moment, just the second hesitation that the post can bring out is Priya. Priya is the second step. I think I'm going to go into it now. Milah, when we say that Milah has, we're talking about Milah today. Milah is not just one step in the process. Everybody, multi-step process. 2 steps for sure. It's Milah and Priya. It might even be a third step. We'll hopefully get to today called Metzitza B'Peh. Might be a third step. And it's a question of how much is involved in the Milah, but everybody agrees that a Milah without a Priya is not a Milah. And so, what is Priya? Priya is less appreciated because nowadays, at least in America, almost all non-Hasidic molim do Milah and Priya b'vad achad. We do it all at the same time. Milah means to cut, and Priya means to peel back. And so traditionally, Priya was done as a separate step because before you had a hemostat, if I could talk out the Milah process, the way I do a Milah, the way most molim do a Milah, and we'll get to the clamps in a moment, is we use a hemostat. We use something that grasps the skin very, very forcefully in a crushing way that it's not going to slip, that's going to pull up 2 layers. It's going to pull up an outer layer and an inner layer. So see, before we had the hemostat, before we had the shield, you might just do a Milah, you might just cut the skin, and then you have an inner membrane which is still covering the atara, which is still covering the crown and needs to be peeled back. And so traditionally that was done with the fingernail. Even there's many that in Israel, that I think in Israel it's the predominant, I can't speak for Israel, but from what I understand, it's the predominant way, it's the Masorah way. Even to the degree where you might hire 2 molim. Can you imagine where in America we don't have this, but when you hire a mole, imagine you have to hire 1 mole to do. Because Milah traditionally, the Priya was traditionally done with a fingernail, the question becomes, can you with a fingernail cut through the membrane to also perform a Priya? With the gloves prevent that? And the answer is it might, and that would be a problem. But respectfully, a lot of molim can do Milah and Priya b'vad achad is one response. Ironically, it works out. The molim who are wearing the gloves happen to be the molim who are doing Milah and Priya b'vad achad. And ironically, the other reverse, meaning the molim in the year 2021 who are not doing Milah and Priya b'vad achad, they're probably also happen to be the molim that are not putting on the gloves. And the other point is that you could use other instruments for Priya, meaning that there is in the sources Milah to using a fingernail, but to be fair, you can use a probe, you can use other devices, the poskim say, to do Priya. So to end off this topic, Rabbi Breish and Rabbi Yosef Weisberg, commonly known as Rabbi Yassel of the Mohel from Yerushalayim, he says that I have special concern for bacterial infection, a mole should not. Silberstein in the Chashuk has some sort of virus, and the mole wears gloves.
Rav Sultan, we didn't hear the last 30 seconds. If you just I think the bandwidth wasn't quite good. If you just repeat the last sort of like 45 seconds of what you said.
Good.
Thank you.
Thank you for interrupting. Letting me know. I'm up to Psak Halacha. Psak Halacha 4, can you use gloves? Rabbi Breish and Rabbi Yosef Weisberg, commonly known as Rabbi Yassel, the respected Mohel from Yerushalayim, says that absent any known illness or special concern for bacteria or infection, a mole should not wear gloves. Number 2, Reb Silverstein rules that it is permissible to wear gloves if the parents of the baby request it, or if the mole has any concern that the baby has some sort of virus and the mole wears gloves to protect himself. Rav Zilberstein specifically and the Sefer Brit, Ramosha Peretinsky are not concerned there's a bizui. And Rav Herschel Schechter of Yeshiva University, he encourages Molim to wear gloves. He argues the Milah is fraught with danger by its very. Kahan mentioned that gave a presentation to this Chabura a few months ago. And Rav Schechter says that if you look in Yevamot, the entire Jewish people, at the time they were in the desert, they didn't perform Brit Milah because the therapeutic northern wind did not blow. The implication is that absent the therapeutic effect of the wind, Milah is inherently dangerous, and any additional safeguard to prevent from infection, which does not infringe on halacha, should be strongly encouraged. A lot of what I just said was based upon what Rav Aryeh Leibowitz wrote up, a Talmud of a Rebbe of a tremendous stature himself, but also a Talmud of Rav Schechter. The last topic I want to launch into is insights as a urologist. Clamps, hypospadias, I saw a question on there, hemophilia, maybe metzitza b'peh, delayed circumcisions, legal ramifications. All right. Clamps. This topic is fascinating to me, the technique. Historically in America, about in the 1930s, OBGYN came over to a savvy Yid with a Yiddish cup, and he put a patent on a device called the Gamco clamp. Gamco stands for Goldstein Milah clamp company, medical company. And he invented a device which is foolproof. And that's what most hospitals in America use nowadays. If you ask somebody if they had if it used to be 60, 80%, now about 50% of Americans, they're born on day one or have a bris on day one or day two. And most OBGYNs are taught to use a Gamco clamp. It's a foolproof device. It causes perfect hemostasis. It does leave a little bit of a lip cosmetically. Urologist, a little snobby, will say that it's not as nice as the way we do it. But that being said, it's a pretty foolproof way of doing it. The problem with it is that it cuts off the blood supply. To devascularize and cause hemostasis, it clamps down for so long that there will be no bleeding afterwards. And part of the essential steps of Milah is that hatafat brit. There needs to be the damecha chayi. There needs to be an element of blood being let out. So while the Gamco clamp seemed like it was made by a Jew and made for circumcisions, and it is the most commonly used device nowadays in America, that's not considered a kosher bris. What's fascinating to me is the Mohel clamp. I don't have a clear answer, and I'm sure if Eddie Reichman wasn't juggling a few patients right now, he'd have more insight. The clamp was invented in 1955 by Harry Bronstein. If I understand correctly, it was invented l'shem shamayim. It was invented with the thought that what the doctors weren't happy with what the Mohel were using, the Mohel weren't happy with what the doctors were using, the Gamco. And so this was supposed to be a compromise. The problem with it is it's too tight. It's occlusive. To be fair, I still see many Mohel using it nowadays. The poskim confuse me about whether or not you can use it. Rav Tendler, God bless him, he used to say that you have to file it down a little bit for it to work. You have to make a little modification. The Mohel clamp is a shield, but it's an occlusive shield. Used correctly, if you release it, and that's what all the Mohel who I say, are you allowed to use this? They always say to me, yeah, of course, it always bleeds. As long as you release it within a few minutes, and nobody's going to leave it for that long. All Mohel nowadays, thank God, move very quickly. It would be considered kosher. I did read that Rav Moshe Feinstein wouldn't go to a bris that used that clamp. I'm not sure that every posek accepts it. I know many poskim do accept it. The key with the Mohel clamp is that it has to allow for bleeding. It has to be released at an appropriate time. And because it doesn't automatically enable that, there are poskim that say on a community level, it shouldn't be used. What most Mohel use nowadays is just a shield, is just a metal device with a slit in it that if you pull up in the right way, you don't leave any, you only take the portion, the foreskin that needs to be taken and not the portion that doesn't need to be taken. I use that. I actually, about 15 years ago, tried to publish a paper in the journals. I was in pediatric training, and we did about, I was lucky enough, my attending said, I'll let you do it. I don't know how we got away with that informed consent, but 10 of the cases when we were just doing pediatric urology cases, while the patient was under anesthesia, rather than doing it the traditional way, I used the Mohel shield in the operating room and then touched it up and then tried to write a paper saying that it's a little bit faster, but the journals didn't pick up on it. It wasn't too exciting for them. There are many papers, though, that show that the use of a Magen shield is faster and potentially has less heart rate or trauma to the baby. And there's also a new phenomenon that we're noticing now more and more. Yeah, we'll get to Joe on this in a second. We're noticing more and more that non-Jewish families are requesting a mohel, either because it's out of the hospital, because it's a family practice, because they hear that mohels are so quick with it. And that's a fascinating topic. I'll shift over to legally. I don't know the answer. See, when I first went into this field, I asked myself, am I better or worse because I have malpractice? Is that going to help me or hurt me? Meaning, if I have my day as a urologist and I'm going to do a few adult circumcisions in the hospital, but beforehand I'll run to shul and I'll do a quick milah, am I liable medical legally now that I have, whereas a mohel, if it doesn't go right, they call me. If it doesn't go right when I do a milah, who are they going to call? They can call my insurance company. So I don't know if England has the same medical legal concerns, but America, there's a lot of malpractice that weighs heavily on a urologist and any doctor's head, especially surgeons and urologists. And so I understood that it actually flipped, that it actually protects me to have that, because if I understand correctly, there was a time, this is, Eddie Reichman would know better, about 5 years ago, San Francisco was trying to ban milahs, and the pushback why we were allowed to do milahs was there's a First Amendment in America, religious freedom. And that, but the irony is that would apply to a Jew, a mohel doing a milah to a Jew. See, what happens if a mohel starts doing milahs for non-Jewish children, and then something goes wrong? The religious freedom argument there is not as protected. So I'm not a legal expert, but that would be an interesting topic because it is a budding phenomenon. Somebody asked about epispadias and hypospadias. That's a topic that, honestly, when Dr. Cohen asked me to speak about, that was one of the more important topics I wanted to speak about. Something changed in the field in terms of hypospadias. If you read all the Sfarim, they always say immediately that what is hypospadias? Hypospadias is that the urinary tract doesn't go all the way to the end. So when somebody urinates, it might drip on the floor. It could also be a question of fertility. But to be fair, there's 3 grades of hypospadias. There's one where it almost made it to the tip. There's one where it's along the shaft. And then there's the most, the worst one where your urethra ends really at the penoscrotal junction. And so if somebody if a baby's born with that, and you see them more and more, respectfully, with the, since in vitro fertilization, more and more babies have hypospadias. The question is, can you do a milah? And all the poskim, rightly so, say stop, blow the whistle. And if you look at the sources appropriately, they say delay the milah until the hypospadias is fixed. I do want to add a tremendous insight with this, which is it's really changed. On the ground, the hypospadias repair has changed in the past 15 years. It went from a flap, meaning a graft, meaning we used to use the skin. And I'm going to hesitate. I'm going to speak strongly, but I'm also going to say that I'm not a pediatric urologist, meaning I was telling Dr. Cohen that anytime somebody asks me this question, I get this question once a week, a picture on my phone, can we proceed with the milah? There's a minor cordie or a hypospadias. The first point is that the repair changed, is that whereas we used to need a lot of tissue for a hypospadias repair, nowadays most of the hypospadias are mild, and the type of repair is called the TIPS, T-I-P-S, which is, I'm going to forget it, but it's an onlay, it's a rolling, it's a folding over of the current skin, the plate, as opposed to doing a rotational flap of skin from the orla. So my point is something that really changed on the ground was, on the one hand, we should feel more comfortable going ahead doing milahs with hypospadias because we don't as much use the type of repair that urologists do for hypospadias doesn't use the same the skin that the orla that we used to use as much. On the other hand, I say in the same mouth the opposite. I don't want to be the one to say that. You must ask a pediatric urologist. A pediatric urologist is going to be the one at between 6 months and 2 years. We recommend a hypospadias repair be done after 6 months because we say by that point anesthesia is a little bit safer. Before 2 years because that's before general awareness happens psychologically. or recovery. So between that time, a pediatric urologist is going to feel very comfortable. It's one of their favorite procedures, but they're the ones that know how much skin they need, if they need some laxity, if they need you to leave a little bit. So it's very important. The answer is you got to ask a pediatric urologist. It's more likely than not they'll tell you can go ahead, but sometimes if they don't, there's a reason for it. In terms of psak halacha, the options are all half or none, meaning some poskim say that you could take all of it and they'll just have a hypospadis. A hypospadis is not going to make somebody live longer or shorter. It can affect fertility, but that's rare. Some poskim say you could do half a milah, meaning you just do some sort of a hatafat brit or some ceremony for psychological purposes or even for kosher purposes if the atara is exposed, and then it can get touched up in the operating room. And then many poskim say that you should do nothing until and meaning it's an inyan to do the milah at day 8, but if the baby has to wait so that it's done properly between 6 months and 2 years, that's also okay. There was another question about hemophilia. There's a lot written about hemophilia. Jaundice was the question, sorry, and I think they overlap. The Gemara talks about 4 different cholim and that you can't do a milah for. Let me do one topic at a time. Hemophilia, there's a lot written about it. There's a question of whether or not you can use lasers. To be fair, I always see that word written, but practically, we rarely use a CO2 laser for cutting of skin. We use it for fulguration of whatnot. Maybe they're talking about electrocautery and hemostasis, but then if you just want good hemostasis, there are plenty of other things that you could use. I think the answer of hemophilia really comes to a geneticist nowadays or hematologist. To be fair, the field has changed so much about hemophilia that we have agents. I'm sure somebody else on this Zoom call is more adept at the chain of that, which factor and which agent 8, 9, 10, and 11 are missing for which hemophiliac. But respectively, you can get an infusion and do the milah, or you could just wait. So hemophilia is a safer topic, but needs to be addressed by someone with expertise. And the other topic somebody mentioned in the chat, I believe, was about jaundice. Jaundice is a very important topic. Let me just read that question. Brit Milah, do you delay circumcision? Physiologic jaundice, risk minimal, not actually contraindication. Additionally, if you have to cut off, would you encourage bilirubin? Right. This is very, very well documented. There's a lot to say about this. The biggest distinction, you're correct, is between physiologic and pathologic jaundice, meaning jaundice is a baby looks yellow afterwards. Jaundice is that the blood products are getting broken down, but the baby doesn't have the bilirubin to conjugate it to filter through the liver, and it builds up and it looks yellow. It can be itchy. That's a natural process. The bilirubin is always going. So physiologic jaundice is it's normal for the bilirubin to go up to 5 to 10. A lot of poskim write numbers. The numbers that I've seen most are 18, 15, 13. Most poskim nowadays respect the doctor's opinions that say that it's a trend, that you'd like to see the numbers going down. As long as the numbers are trending down, and it's not, and the question is it a systemic illness or not? I believe most, I don't know the answer to that, meaning if it's a systemic illness, you have to wait 7 days, may 8 late from the time of the recovery. If it's a local illness, then the moment that the illness passes, somebody is kosher for milah. I'm getting Josh Levine is making a comment. According to the Gemara Rashi, the issue with jaundice is that he won't bleed. Is a lack of bleeding dangerous? Or is there modern research that connects jaundice and bleeding? Good. So maybe somebody, as a urologist, maybe somebody else on this chat is welcome to chime in. The connection I'm making is between the blood products, but those are old broken down blood products, meaning somebody with jaundice and hemophilia is not the same. Somebody with jaundice is not more I get confused by this. Somebody with jaundice is not more likely to bleed out. You're saying the Gemara says that he won't bleed. Is there a problem? Respectfully, every meal I've ever seen, we can get hataf adam brit. So I don't know exactly how to connect the two, but I respect anybody else's comments in terms of Josh's comments. I'm gonna say a nice story I heard on YU Torah is Rabbi Sobolewski once from Yeshiva University mentioned that there was a time where the Milah was supposed to happen on Friday. It didn't because the baby was still jaundiced. And then they said, oh, we're going to have to push it till Sunday. And he said, well, actually, Amir al-Nachri is only an Isser Dirabanan, and to do a Milah in a timely fashion might be Diaraita, according to some. So he had them test the blood. They had them check the hemoglobin, the jaundice level at the bilirubin level on Shabbos morning, so that you can then find out in the afternoon if it was kosher to proceed with the bris. The last topic I'm going to briefly brush through is Metzitza B'Peh. Metzitza B'Peh is a topic that everybody always tunes into. I think that the topic really changed in the past 15 years, meaning this topic is not new. Rabbi Reichman could say better than me, at least 200 years. The 1800s, the Chasam Sofer, they were talking about something that sounded remarkably similar to a herpes outbreak from a certain mohel in Germany or Vienna or something. Someone asked the Yad Eliezer, asked the Chasam Sofer, and it wasn't a published tshuva, but I believe there the Chasam Sofer said if there's a health concern, we could back off. What's the reason we do Metzitza? I glossed over that because the Gemara says, Mal she'ena molim motzitzin, we remove him, meaning it's a prerequisite. You get fired. You get fired if you don't do a Milah. It's a critical portion. What's fascinating is that the Chasam Sofer, I believe, pointed out that it doesn't say Metzitza B'Peh. See, Peh has a gematria of 85, Elokim has a gematria of 86. All the sources say to do Metzitza B'Peh, but it's fascinating, where did that come from? Because the Gemara simply said that you just have to suction from a komo to rachokim. You have to get a suction that will pull out, in theory, if their knives were, dirty back in the day, maybe pulling out the blood, and at that time was considered health beneficial. It is. The Gemara says that it was beneficial to a degree, where it was life or death, where it was critical that a metzitza be done, the suction be done. But it doesn't exactly say that it has to be done b'peh. Halachically, historically, we've always done it b'peh, but the poskim even 200 years ago, Chasam Sofer, sounds like you might be able to use an alternative form. I believe he was saying you can use gauze. I have a tough time understanding how gauze absorbs, but gauze does not create a suction. Almost every American, I did read somewhere that Rav Shechter said that the Rav Soloveitchik said that his father wouldn't even allow Metzitza B'Peh, but Rav Yosef Dov Soloveitchik allowed Metzitza B'Peh. It's clear to me that almost every American non-Hasidic posek uses what's called the suction method of a, they always describe it as a glass pipette. I'm not sure why it has to be a glass pipette. Anybody could just walk through a hospital or a medical device and take a 10 cc syringe or a 30 cc syringe and just pull out the plunger from the back. And you could put a roll of gauze inside there so that the blood doesn't actually hit your lips. And you can create a good seal. The babies are fat enough that if you push the back of a 10 cc syringe, empty syringe onto a baby, you get a great seal and you get great suction, and you always see blood on the gauze. So that's been the psak that I almost every American posek or mohel that's non-Hasidic is doing, depending on the parents' preferences. I will say that even in the past 5 years, I saw a change in what I'm hearing about Metzitza B'Peh, meaning 5-10 years ago, when the mohelim were talking, there was a prominent mohel in America, in the New York area, that had a few outbreaks, and the media caught on, and it was really ugly. And when it was so vociferous, thank goodness there was a response back from the Jewish community of, we have to respect tradition. I do sense a little bit of a movement now in the past 5 years to more and more poskim saying we need to respect tradition, but that tradition can be respected by using a barrier or a separation. Doesn't have to actually be b'peh. That's pretty much most of the topics I wanted to cover. I'm going to read the chat now. Anybody, I would appreciate if anybody would unmute and add insights. I'm not used to speaking on Zoom, and I missed the interaction.
Just a couple of, do you want
Go ahead.
No, if you want to go through some of the, I don't know if there's more like statements or queries that they've put in the chat to yourself.
All right, I'm going to run through them. In the case of epispadis, hypospadias, do you delay the Brit? So we talked about that. You really have to show a pediatric urologist. Amitai's phone as urologist, delay the Brit physiologic jaundice. It's not for, so the answer is not for physiologic jaundice, only for pathologic jaundice, which means really high numbers, where we suspect that it'll cause kernicterus. And I'm sure Eddie Reichman could tell you the cases of kernicterus are almost nil. Additionally, if you have a cutoff, what would your number be? I don't have a number. It just needs to be trending down. Joshua Levine, according to Gemara, jaundice is that the baby won't bleed. I'm not sure I understand that. The lack of bleeding is dangerous. Are there modern research that connects jaundice with bleeding? If somebody else understands that the jaundice should not cause lack of bleeding, I'm not sure. Yosef, do we follow doctor's opinion in Hilchot Treifos too? The Gemara in Shulchan Aruch doesn't differentiate to what type of jaundice. Correct. That Yosef's correct. That's when you read, that's more a modern spin on things. Correct. Menachem Stolzberg, on the story before, are we allowed to hurt the baby to find out the jaundice level? Good question. Meaning, every time we get a blood level, it's not a full blood draw. You could just do a heel prick and get it. And can you just look at if the baby's yellow or not? I'm going to defer to a pediatrician who deals with that every day. Yosef Chasam Sofer says, if the other way is as strong as the mouth, I doubt if this is the case. It seems that the mouth is the strongest way. It depends if you can get a seal. I've seen many people, Yosef, with the mouth be hesitant to do it and not do a full suction. And I've seen the reverse. I've seen people who, if you get a good seal with a test tube, you could get a lot of pressure pulling back because it's concentrated, because the mouth of the pipette is very tight. Josh Levine, does Priya that gets stuck on the bottom of the head ever lead to skin bridges? Yes, it does. That's an important topic I'd like to talk about. Are the skin bridges related to orla that only attaches to the head? So both, Josh, your question is well received, meaning a lot of molim now, I'm makpid before I do a bris. If you ever seen some molim before the bris, to go take the baby before and to prepare, what we're doing is we're releasing those skin bridges. As a urologist, I have many patients who are bothered afterwards about skin bridges or frenulum that's still tight, but you can release them beforehand. So if I do beforehand, I'll peel back the foreskin and use a probe and release it. It makes the Milah come out so much nicer than when the Milah and Priya Vavadachat happen, it really peels back. So skin bridges can happen if you don't do a complete Priya, if you don't do a full Milah and Priya Vavadachat. And meaning it's natural, meaning a baby's born where there are attachments. And then during puberty, testosterone is when they usually get released. Edgar, an obvious connection between jaundice and coagulation would be that jaundice may be indicative of liver failure, which can impair coagulation. Yes, correct.
Moshe David Spitzer wanted to ask a question. Go ahead.
Hello, hello. I'm interested in, thank you very much for the shiur. I'm interested in your perspective as a surgeon who's a mohel as well. I think you'll find two different attitudes, or certainly I've encountered that with doctors who are mohelim as well. Mohelim who are not doctors, they're trained in the traditional way, and they do it in a shul, in a non-sterile environment, one could argue, and without gloves and metzitza b'peh. And you have some doctors who, in their professional practice, they say, well, I would never ever do that. It's impossible for me to do work like that in an operating theatre. If I was doing it in a hospital, it would be with sterile conditions, with anesthesia, with gloves, no question of doing metzitza b'peh at all. And they will then apply that to all other brisses they do, even in a non-medical capacity. And other doctors who are mohelim will say, look, what I do at work is work, medical, and when I'm a mohel and I'm not a doctor. I'm just interested in your thoughts on and advice on that.
You articulated perfectly. My wife hears me say that exact double step all the time. I feel much more comfortable doing a Milah in a hospital. I have anesthesia. I have sterile environments. I get to touch it up. When I did a Milah on my son the first time, I perseverated for 6 months waiting for it to heal by secondary intent, meaning a Milah done in a shul is not the way a Milah that a urologist wants is comfortable doing it. I feel uncomfortable when a mohel tells me that they can fix a core D or a hypospadias by cutting it. That's not true. A core D means that there's not enough skin, and to say that by cutting you're going to release a core D, that's not true. So I don't feel comfortable when a mohel oversteps his bounds. I don't feel comfortable as a doctor pretending that the shul is a is a place where I do my standard circumcision that I would do in the shul. And I've spoken to friends who've said to me that there's a reason why we don't encourage doctors to be mohelim, because it would change the field. You'd have every parent calling saying, I want a doctor in this environment to be doing it. And there are things that I've started to do which I feel nervous about. I put a marking pen. Before I do surgeries, I use a marking pen. So now when I do a bris, because I know I do the priya beforehand, and I do a very thorough, because I'm worried about those skin bridges, I do a very thorough priya beforehand, or release of skin bridges. I know there's going to be swelling, so the mark helps me. I also know that I've started cheating and using what's called dermabond, which is crazy glue. 1 or 2 days later, what bothers me, as you said, as a urologist, is I know how a circumcision is supposed to look when it heals. But when you do it in the hospital, it heals instantly. When you do it in shul, it has to heal over time. And if anybody's on these phone calls, Zoom calls ever changed the bandage after Mila, it looks really, it doesn't look perfect. It has to heal. And so I've cheated towards using what's called dermabond or crazy glue, what a lot of the plastic surgeons use, to just bring the two edges together sooner rather than later. So I hear your question. I don't have an answer. I struggle with that.
Thank you. Thank you. That's very interesting and enlightening. Thank you.
Thank you. I think we have something else from Joshua Levin there.
I see. Sometimes I see the whole priya gets stuck to the bottom of the underside of the head. How can we tell now when he is an infant whether or not the increase in testosterone puberty will cause the priya to disconnect from the head? Good question. The underside is much less worrisome than the overside. I mean, the top side, the dorsal is where it's going to be kosher or not. The ventral area, the underneath side, it always has swelling afterwards. Those you're more encouraged to give it time for it to go down. Rarely, as an adult urologist, I rarely see problems with ventral adhesions or redundancy. But the answer, Yosef, is specifically you just have to show it to a urologist or a pediatrician. Yosef, I had doctors ask me to do bris and shul for their babies.
Just as an anecdote, I remember we used to go a lot to Rav Chaim Greineman, who was the nephew of the Chazon Ish, and his father is the one who used to publish all this. The Sefer Chazon Ish, he says Shin Greineman, who was his father, used to publish it. So he learned B'chavruta with the Chazon Ish, and I asked him once about Metzitza B'peh. I was expecting him to say, of course, you have to do it. They're Litvish. And I was quite young, and I expected him to say, yes, you must do it with the mouth and so on and so forth. And he said, no, just use a pipette. And when I asked him again, I said, can I be mefarsem this? Because I thought maybe it was something unusual. He was like, absolutely, why not? It's absolutely fine to do it with the pipette. He was very comfortable. And I remember that's when I realized that there was a big divide between the Hasidim and between certain parts of the Litvish world when it came to Metzitza B'peh, whether you have to do it with the peh or you can do it with some sort of instrument. And the other thing I wanted to ask you, I always found it fascinating that Harambam in Perek Aleph of Brit Milah, when he talks about the baby who's Yarok Beyoter, he says El Molin Oto Ad Sheipol Bodam Vayachzeru Mar'av Kemar'eh HaKetanim HaBri'im. They didn't have these measurements that we go on. I never understood, why halachically we could have these cutoffs. The reality is the Rambam says you look at the baby. If the baby looks like haketanim habriim, you do the Brit Milah. If it looks a little bit off, you don't do it. And I wonder what your feelings and thoughts are, because I always wonder these numbers, machloket poskim this way and that way, they don't have a source in the Talmud. I appreciate we're trying to make it easier for doctors to do things, but the reality is that's what the Chachamim had. They looked at the baby. If the baby looked okay, they did the Brit Milah. If the baby looked off, they didn't do the Brit Milah. How do you feel about these numbers, 18, 19? I mean, I don't know, I'm not a Mohel, but these specific numbers.
I agree with your sentiments. When there was one number, it might have been clear, but because there's so many different numbers and opinions and rabbinic advisors to different poskim, it becomes clear that it's a trend. It becomes clear that you lean back on what I think the Rambam said, Yarok Beyoter. It's a look.
I think that's all the questions. Let me just make sure there's nothing else we have.
And we as Molim try to use Dermabond. I think so. Dermabond absorbs after 2 weeks. It's very safe.
What is Dermabond exactly?
Dermabond's what a lot of the plastic surgeons are using nowadays when they don't want to put in stitches. It's just crazy glue with one of the ingredients, the caustic agent that would burn substitute. It costs a lot of money. I think it costs $20 or $40 a vial, but it's liquid glue. It's essentially stitches, and it goes back to the question was it Dr. Spitzer was asking of if a doctor starts doing Milah, are they going to start applying some of the tools and techniques? I have mixed feelings about that, but honest in real life, as I've started bringing, I'm not going to bring a stitch to the shul, but and there are sometimes we have to put in a stitch if there's bleeding, but I found that Dermabond is a trick that I use just because as a urologist, I care very much about the two edges approximating nicely, and Dermabond does that for me.
Do you have a few more minutes just to address some of the other questions that have just come up in the chat, Ray?
Sure. When a baby is a few months old and gets chubby, his skin gets attached to the head. Do we need to keep separating it, or will it eventually sip on its own? Yes, see, we get that question all the time, and it depends who you ask. And the answer is people with gray hair and experience will tell you patients it'll separate, and more aggressive pediatric urologists will say to apply hydrocortisone cream 3 times a day. I had a family that I like very much, and they had a situation like this, and they were diligent. They applied hydrocortisone, a steroid, I'm sorry, maybe not one for the babies, but a steroid cream 3 times a day, and kept peeling it back every time they took a bath, and it healed beautifully. So you could do either way.
And I think that's it. No other questions. Chacham Ray, really, really thank you so much. Oh, we have another one from Dr. Levine.
Does the priya keep growing after the bris? After we tear it? No, I don't think so. I think it epithelializes, meaning it covers up on the shaft. So I don't think we still have a worry about a priya if it's pulled back.
Really, really thank you so much for such a wonderful and insightful review of some of the most common questions and challenges that come up. Really, you've given me so much, and everyone else here. We have some very eminent Mohalim here from the UK and from abroad who've joined us. Thank you very much. And hopefully we'll be able to host you in London for our face-to-face event that we're going to have at some point when all of the things with COVID are over. And b'hatzlacha, and really, really thank you so much for taking the time.
Thank you. Have a good night.
Thank you. Kol tov. Bye-bye.